Hello, welcome to my channel. So we're just going to be driving together as I head to work, and I'll be keeping safe. So if I don't look at the camera, it's because my eyes are on the road. So let's just drive together and join me as I talk about coping with chronic illnesses. So one thing we know is that living with chronic illness is not easy, whether it's diabetes, whether it's another kind or form of cardiac disease like congestive heart failure, high blood pressure, or if it's any bone related diseases like arthritis or chronic joint pain per se. It may not come easy if you don't have somebody to work with you through these points. So to get us started, thank you and welcome to my channel. My name is Claudine. I am doctorally prepared nurse practitioner, and I have been in the healthcare for at least the last 10 years. And with my vast knowledge, I share this not only with my patients, but also with you as my audience from the other side of the screen. So the first thing really, once you're diagnosed with a chronic illness, is that your doctor will talk to you about what the disease is. And at this point, you're overwhelmed. Let's say you just get a diagnosis for cancer. You're overwhelmed, you walk out, you don't know what you're doing, you're confused. You're going through the 5 stages of grief. Yes, people go through grief for any unintended or unexpected chronic illness diagnosis. So at this point, you're going through the disease process just to understand what it is. And by the moment you leave your doctor's office, you probably won't remember what they really told you about the disease process. So as an individual, it's your responsibility to go back to the resources and try and read more about the disease, what to expect, what are your treatment options, your treatment goals. So basically, what I'm trying to say is be able to read more about the disease and understand it. And with this, you'll be able to know, is your disease getting better? Is it getting worse? What are some of the complications to watch for? So yes, learn the disease. Number 2, which is almost tied to the first one, is learn your treatment plan, your medications. What are some of the side effects that you can experience from your medication? Take an example of being on furosemide, which is a fluid medication. It helps eliminate extra fluid from the body. This can be prescribed if you have a disease like congestive heart failure. This can help relieve the extra fluid. But at the same time, while you're taking this medication, you need to be aware of some of the side effects that you can experience. As I mentioned, your doctor will not be there with you to monitor you 24/7. So you have to be able to understand this as an individual and even as part of the support system that's helping take care of this patient. Another thing is to really monitor for any worsening of symptoms. And these are some of the things which will help you realize that I need to go back in and see my doctor, or I need to call my doctor just to see like what do they want me to do. Or the worst case scenario, if it's off hours, you need to go to the nearest emergency room. And this will help you push through the disease process in a better way without straining yourself. The other thing I really want to talk about is finances or even insurance coverage. Going through a chronic illness, one thing you know for sure is that you will be taking medications, you will be getting routine care, and this includes a doctor visit, emergency room visit sometimes, and even just routine blood work. Not forgetting about imaging like CT scan, MRI, ultrasound. All these will be things that you'll be experiencing on a routine basis. So how do you cope with this? It may be hard for you if you're not well prepared financially. And as we know, sometimes it's hard to pay all these things out of pocket. So your best bet will be really to have some kind of insurance coverage. There's a lot of options for commercial insurance. They may not be the cheapest, but at least you know you are covered in one way or another for your medical or your chronic illness. And this applies to mental health as well. Let's say you have schizophrenia, bipolar, depression. You'll need your medications on a daily basis. So being able to pay for this, whether from cash or whether from insurance, is really, really important. Another thing to really pay close attention to is your documentations, and these include, basically these are your legal documentations, like your living will, your power of attorney, somebody who can make decisions on your behalf when you are not able to. And you need to be able to discuss this with both your immediate partner, your kids if they're grown, to understand really what you want, and even your other family members, just so when things turn on the other direction, at least you all are on the same page, and they'll not be like dragging each other left, right, and saying, no, she didn't want this, she didn't want that, he didn't want this or that. So with those, at least you'll be on the same page, and make sure you have these documentations legalized, and if needed to be, file them with an attorney or where you can retrieve them when you need them. And even keep them with your doctor as a copy, so even your doctor understands and knows what you want and knows who to talk to when things need to be done or decisions need to be made. One final thing I want to talk about is having a support system. Family to church family to work colleagues, going to be working for a company. One thing you really need to look into is, do they offer support system? And that's really, really critical, because if you can't come to work because of your chronic illness, are they going to reprimand you if you miss work for 2 or 3 days in a row? Or if you keep missing work like every other week because you have to go to the hospital, you have to go see your doctor, or you have to stay home just because physically or emotionally or mentally you're not in a state to be able to go to work. The other thing was a church family. One thing I recommend is to be part of our smaller church family that really know you. The whole church don't need to know who you are, but at least having a couple of people within your cycle at church can really help you go through these chronic illnesses with ease. And one brother or one sister will let another one know, and another one, and before you know, you have a community of church that are with you. So having at least one person within the church community that can work with you during chronic illnesses, that can come pray with you and just give you an ear to listen, is one of those things that I really recommend. So I hope these are very important points that you can consider if you're going through chronic illness, whether yourself, whether a family member. Really, these are some of the things that can be very beneficial and will help you go through this process in an ease. So thank you so much for joining me in this video, and I hope we can discuss again another video coming up soon. Cheers.